I'm Ella Jinjin. Today I'll show you how to perform a skin test, so you won't be unsure where to start when handling a tattoo removal. First, choose the appropriate energy setting based on your machine's configuration. The key factor here is the spot size selection. The images and videos show skin tests done on shaded and lined areas. The depth of pigment insertion differs between the two. To ensure minimal skin damage and the best results, I tested with spot size 5, 2 passes, and spot size 4, 1 pass. The 4mm spot already broke the skin, so there's no need to test with 3mm. Normally, you can test using spot sizes 3, 4, and 5. Immediately after lasering, the skin will turn white. At this point, apply ice for 15 minutes, then gently wipe with saline. Looking back at the result images, both 4mm and 5mm spots show good color reversal, but the 4mm one caused skin damage. To minimize trauma while maintaining optimal pigment removal, we'll skip the 4mm and use the 5mm spot with 2 passes per point for the shaded area. Parameters can be adjusted flexibly. In areas with heavier saturation, you can tap 3 times on a single point. For the line areas, the 4mm spot broke the skin and caused more trauma, while the 5mm didn't break the skin but appeared dark under redness, meaning since the line area shows some hypertrophic tissue, a light-controlled break of the skin can help flatten it after healing. The final choice. Use the 5mm spot. Slightly increase the distance by 1 finger, roughly equal to 4.5mm parameters, and make 2 passes per point. Once parameter testing is complete, disinfect the area and proceed with the full treatment.